la voz experta de la asociación. En Radio AMEDLA ya tienes la solución.
Welcome back to the Deep Dive. Today we are embarking on a really intense journey.
We are.
It's into an area of forensic science that is not only vital for justice, but it's actively addressing a profound humanitarian crisis.
Absolutely.
Our source material is this incredible webinar on forensic dentistry and human identification, and it was presented by the highly respected Dr. Arturo Zamora Alvarado.
It's just such crucial work, and I think our mission today is to really synthesize the complexity of what Dr. Zamora presented.
Yeah.
I want to show you how dental science moves beyond the clinic and becomes, an essential tool for human rights.
And resolution, yeah. Before we fully unpack his research, just a quick logistical note for you, our dedicated listeners.
Yeah.
We invite you to watch the monthly AMEDLA webinars live.
Oh yeah, they're great.
They are. You can find them at www.twitch.tv/AMEDLA, so please do follow that channel to stay current. And if you need to catch up, the previous webinars are on YouTube.
Right, at www.youtube.com/AMEDLA official.
Exactly. And work is ongoing to get those subtitled and dubbed into English, which is fantastic for a wider audience.
Okay, so let's talk about the expert himself, because his background is, it's essential context for the innovation he developed.
It really is.
Dr. Zamora holds master's degrees in both criminalistics and forensic sciences, and also multidisciplinary health. He's certified as a forensic odontologist in multiple states across Mexico, Nuevo León, San Luis Potosí, Coahuila.
And he has that unique international certification, right? To work in Brazil, Paraguay, Chile.
He does.
And most critically for this deep dive, he is the creator of the Zamora Technique.
The Zamora Technique. It's a groundbreaking, statistically solid method for estimating dental age. And it truly revolutionized the field in a time of just dire need.
So where do we start? I feel like we first need to define what forensic dentistry even is.
Yes. We have to clarify the scope. When you hear that term, you probably picture, crime scenes, cadavers.
CSI.
Exactly. But Dr. Zamora emphasizes that the field is so much broader. It's basically the application of any dental knowledge within the administration of justice, within a foro or a hearing.
So it's not just post-mortem work. We can kind of split it into two main areas.
Right.
First, there's the legal component, which is entirely non-cadaveric. This covers things like dental malpractice cases or quantifying damages from injuries.
Like in a fight, for example.
Yeah, exactly. Determining if an injury will cause temporary dysfunction or if it's going to become permanent. And it also covers the legal side of just running a clinic.
And that's a point that is so relevant globally. Every clinic, it doesn't matter what country, has to deal with financial and regulatory bodies. In Mexico, you're talking about agencies like Hacienda or the SAT.
So the forensic dentist helps make sure all those records are compliant.
Exactly. But the second component, victim care, is where that connection becomes deeply, deeply personal. Dr. Zamora highlights the legal obligation every dentist has to report victims of violence or mistreatment.
And the source gave this really surprising example.
It was eye-opening. A child comes into the chair with a huge number of cavities, active caries. That, by itself, constitutes a reportable case of maltrato por omission.
Abuse by omission. Wow.
Yeah.
It totally shifts the role of the dentist, doesn't it? The exam chair becomes this crucial front line for protecting vulnerable patients.
It really does. Now, if we move into the specifically forensic universe, the focus is identification. And we have to distinguish between identity, the characteristics that make you unique, and identification.
Which is the process used to prove that identity.
Precisely. It's the systematic process of collecting and comparing those characteristics. The goal is certainty. And as we'll see, teeth provide incredible certainty.
Let's ground this technical field in the urgent context that made Dr. Zamora's work so critical. We're talking about a humanitarian tragedy in Mexico. It was called a national forensic emergency.
The statistics cited from a July 2020 Forbes report they're just staggering. You have to hear them to understand the scale. At that time, over 40,000 disappeared persons.
40,187 to be exact.
And a corresponding number of over 37,000 unidentified dead bodies. And we should note, the unofficial estimates push that national disappearance figure past 100,000.
Just think about the human toll of that. Tens of thousands of people who are juridically neither alive nor dead.
And their families are just stuck in this relentless state of anxiety. They can't get closure.
Can't move on.
The situation is so dire that the CICR, the International Red Cross, is involved in Mexico. And they only intervene in countries dealing with, humanitarian crises or civil war.
That really puts the challenge into a stark international perspective. So with that level of crisis, why isn't the work of brilliant forensic experts enough? Why can't they just analyze a body and get an ID?
Because the most advanced forensic analysis in the world, the most detailed dental workup, is completely useless if there is no comparative record.
The confrontation data.
Exactly, what Dr. Zamora calls confrontation data. If a body is found, but the missing person's dentist didn't keep good records, the process just hits a brick wall. The remains become another number in the unidentified count.
That puts this enormous, probably unexpected burden on the ordinary private dentist.
It's huge. Legally, they have to maintain 100% complete clinical records, dental charts, and supporting material like models or x-rays.
And for how long?
For a minimum of 10 years total. 5 years active in the clinic, plus another 5 years in an archive.
10 years is a big deal for a small practice. Does the work address how hard that is, with the digital systems and data integrity and everything?
It does, implicitly. The emphasis isn't just on having records, but having them be accessible and legally complete. The difficulty is real, but the consequence of failing is just. It's too severe.
You're blocking a potential identifier.
You're denying a family closure. So record keeping isn't a chore, it's a potential active humanitarian service.
So let's look at why dental evidence is often the superior tool. You have the 4 big lines of identification: visual, fingerprints, DNA, and odontological. Where do the others fall short?
Well, visual ID is. It's traumatic for families, and it's deeply unreliable. Bodies change color in refrigeration, and family members might reject a correct identification because the person just doesn't look like they remember.
And fingerprints, the classic police go-to.
Fingerprints are fragile. They deteriorate really fast with decomposition or fire. And historically, the database in Mexico was weak because prints were mainly taken from people who were detained.
So no comparison for most missing people. Now, I think a lot of listeners would assume DNA is the final answer. What's the core limitation there?
It's really cost and logistics. DNA is incredibly expensive, up to 8,000 pesos a test, and you need multiple reference samples.
From the mother, father, siblings.
Right. And for many families, especially in low-income areas where disappearances are common, that's just an insurmountable barrier.
And that's where teeth really shine. We hear they're almost indestructible.
They pretty much are. No two sets of teeth are alike, so they have the uniqueness of fingerprints. And they resist extreme conditions, up to 1200 degrees Celsius, strong acids, the passage of time.
Can you walk us through the actual process? Say a body is intact but has rigor mortis. How do you even get to the teeth?
To minimize damage, the forensic odontologist does what's called a facial lift, or a levantamiento facial. It's a very precise trapezoidal cut.
Okay.
The whole goal is to access the jaws and teeth for documentation without causing any unnecessary trauma, which is really important if the body might be viewed later.
And the analysis itself is hyper-specific, right? Way more than a medical doctor would provide.
Oh, the difference is immense. A medical doctor might just note a malposition of a tooth. The odontologist, however, documents if it's a gyroversion, a rotation, lingualization.
All these specific terms.
Right. That specific language is what you need to match the remains precisely to a detailed clinical chart.
Even with skeletal or burned remains, the process sounds just relentless.
It is. They meticulously clean everything, documenting ante-mortem versus post-mortem tooth loss, the exact type of restoration, like an 8-unit metal acrylic bridge. Those restorations become unique identifiers.
Better than a tattoo.
Much better. Now let's talk about what the teeth reveal about the person. They contribute to the basic quartet of identification: sex, racial group, and age.
Okay, so how do you determine sex from teeth?
The most objective method is analyzing the bar body.
The bar body, for those who don't know.
It's the inactive XX chromosome. You can see it in the dental pulp or oral mucosa with simple staining. If it's there, the individual's female. It's way more objective than just looking at, say, the size of the jawbone.
And racial origin, that seems much trickier.
It relies on specific genetic traits. For example, shovel-shaped incisors are characteristic of Oriental populations. More common in Mexico is the Carabelli tubercle.
What's the significance of that tubercle?
It's a small cusp on the molar. Dr. Zamora noted it has 8 known variants, and its presence suggests Mongoloid or Amerindian racial groups, or the mestizaje, the mixed ancestry common in Latin America. It helps narrow the search.
And teeth can even reveal geographic origin, which is incredible.
Yes. You look for markers like dental fluorosis, that chalky modeling on the teeth. If you see that, the person might be from a state like Zacatecas or San Luis Potosí, where there's high fluoride in the water.
Or even regional preferences in dental work.
Exactly. A preference for metal crowns in the south versus aesthetic restorations in the north. It's a complete biohistory embedded in the enamel.
A life record, even lifestyle or occupation.
Absolutely. Direct factors, like a shoemaker holding nails in his teeth.
Causing specific wear patterns.
And indirect factors. Dr. Zamora noted miners often develop opaque teeth because of the lack of oxygenation in their work environment.
Okay, let's pivot to the innovation that really changes the game. Estimating the age of an adult. Once development stops around age 25, the old methods were just wild guesses.
That's the critical problem the Zamora technique solves. For years, Mexico was using techniques developed for other populations. The La Mendin technique from France was the standard.
But it had a huge margin of error.
Massive. An average deviation of 7.2 years.
Yep.
But it could be off by as much as 15 years in some cases.
That's useless. I mean, it's worse than useless for an investigation.
It is. And the other method, the Cameri technique, could only really tell you if someone was older or younger than 24.
So Dr. Zamora needed to find something in the tooth that kept changing predictably throughout adulthood. What was the breakthrough?
He isolated two variables. The most reliable one, by far, was the transparency of the root, or radicular translucency.
Okay, so the root becomes more see-through over time.
Exactly. It's caused by the sclerosis, the filling in of these microscopic dental tubules with hydroxyapatite. This process starts reliably around age 20 and progresses systematically.
And the second variable?
Periodontosis or gum recession. By combining these, he developed his own regression equation tailored specifically for the Mexican population.
And the result was a huge jump in accuracy.
Huge. The statistical error dropped from 7.2 years down to just 3.7 years.
Wow.
And this is vital because so many of the disappeared from the peak conflict years, 2010 to 2012, were young adults in that 25 to 40 age range where the old methods just completely failed.
And the validation cases he shared really prove the impact. Tell us about the carbonized body.
So there was this one victim, carbonized, whose true age was 50. The old La Mendin technique estimated his age at 56, a 6-year error.
Okay.
The Zamora technique estimated the age at 48.
Much closer.
So much closer. It dramatically narrowed the search for the investigators.
And there was that other case, the buried and burned victim, which shows how the forensic expert and the private dentist have to work together.
It's the perfect example. Identification was only possible by combining unique fragments from the scene endodontic residue, a metal porcelain bridge, with the detailed records from the victim's own dentist.
And the detail that clinched it wasn't just the chart, it was a drawing.
Correct. The dentist had included a little drawing of a prior jaw fracture and a very specific custom notch he had to cut into a prosthetic to make it fit.
That one human detail.
That singular detail, matched with the science, made the evidence undeniable.
All this technical rigor, all this statistical accuracy, it all leads back to the humanitarian purpose.
That's the ultimate impact. Dr. Zamora didn't sell this technique. He gave it to society for purely humanitarian reasons, to give families a more serious, reliable tool for closure.
And now it's official protocol.
It is. It's registered, published internationally, and adopted as protocol by Mexico's FGR, the Attorney General's office. It is giving resolution to families who have been stuck in that horrible alert state for years.
The science is admirable, but the personal reason behind it all is why this work matters so much.
And we'll end this with a reflection Dr. Zamora offered, which raises a really essential question about professional culture. He noted that while his work was embraced internationally in Chile, Guatemala, Brazil, he often faced resistance and even denigration from inside his own professional community in Mexico.
I called it the Mexican crabs phenomenon.
Yeah, where internal actors pull each other down instead of lifting each other up.
It's a powerful and provocative point about the barriers to real innovation. So we want to challenge you, the listener, the professional. When you encounter serious, proven research like this, how do you actively support it? How do you elevate it for the greater good of those seeking justice? It's a call to foster a culture of professional elevation.
Thank you for joining us on this deep dive into the profound intersection of dentistry, science, and justice.
We really encourage all of you to follow us on our social networks, share this content, and please don't forget to register for our free monthly webinars.
And extend that invitation to become members through www.amedlawsa.org. Remember that the certificates with curricular value from AMEDLA are officially endorsed by the SIPRIM, Mexico's Ministry of Public Education. Until next time.